Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Pelviscopy. Introduction. A pelviscopy is also known as a pelvic laparoscopy. It may be used to diagnose or treat certain conditions that affect the pelvic organs. A pelviscopy allows a healthcare provider to see inside the abdomen and pelvis with medical scopes. If your healthcare provider recommends a pelviscopy for you, the decision whether or not to have this procedure is yours. This program will help you better understand the benefits and risks of pelviscopy. It discusses when the procedure is needed. It also covers what to expect before, during, and after the procedure. The pelvic organs. This section reviews the anatomy of the pelvic organs in order to help you understand a pelviscopy. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. The female reproductive organs include the ovaries, the fallopian tubes, the uterus, the cervix, the vagina. The ovaries have two main functions. The first is to make hormones such as estrogen and progesterone. Estrogen and progesterone are needed to regulate the second function of the ovaries, ovulation, or the release of eggs needed for reproduction. These hormones also prepare the inner lining of the uterus for pregnancy. When an egg is released, it goes down to the uterus through the fallopian tube. If the egg is not fertilized, the egg and the inner lining of the uterus leave the body during the menstrual period. If a pregnancy happens, the fetus stays inside the uterus until delivery. The uterus is able to increase in size to make room for the growing fetus. The pelvis also contains other organs, including parts of the urinary and digestive systems. Structures of the urinary systems in the pelvis include the ureters, the bladder, the urethra. The bladder is a hollow organ in the lower abdomen. It stores urine, the liquid waste made by the kidneys. Urine passes from each kidney into the bladder through a long tube called a ureter. Urine leaves the bladder through a shorter tube called the urethra. Structures of the digestive system in the pelvis include some of the small intestine, some of the colon or large intestine, the appendix, the rectum and anus. Digested food goes from the stomach to the small intestines, where most nutrients are further digested and absorbed into the body. Fibers and digested food next reach the colon. In the colon, the rest of the nutrients get absorbed and stools or feces are formed. Stools are stored in the last part of the colon before being excreted. This part of the colon is made up of the sigmoid colon and rectum. Stool leaves the body through the anus. Reasons for a pelviscopy. Many medical conditions may require a pelviscopy. The following are descriptions of some of these conditions. There are many causes of abdominal and pelvic pain. A pelviscopy may be used to diagnose the cause. Causes may include cancer, endometriosis, fluid buildup, infection, inflammation of an organ, internal bleeding, scar tissue. Sometimes a lump can be felt in the lower abdomen or pelvic area. The mass may also be discovered by radiological tests. A pelviscopy can be used to look at the mass and obtain a tissue sample for diagnosis. This is called a biopsy. If an abnormal mass is small, it may be removed during a pelviscopy. A pelviscopy can also be used to find and treat an ectopic pregnancy. This is when the fertilized egg grows in the fallopian tube instead of the uterus. It can also find and treat endometriosis and other problems that affect the female reproductive organs. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Before the procedure. A pelviscopy is usually ordered after other diagnostic tests such as CT scan, MRI, ultrasound. Before a pelviscopy, a healthcare provider usually orders routine blood tests and urine tests. In some cases, a chest X-ray or an electrocardiogram may be needed. In most cases, a pelviscopy is performed in an outpatient setting. This means you go home the same day the procedure is performed. You should not eat or drink for at least 8 hours before a pelviscopy. You can shower the evening before your scheduled operation. Clean your belly button with soap, water, and a cotton swab. Talk with your healthcare provider about any medications you are taking. Blood thinners and aspirin may need to be stopped before a pelviscopy. Your healthcare provider will give you more specific instructions to prepare you for a pelviscopy. Instructions differ based on your age and medical condition. Pelviscopy. A pelviscopy is most often performed under general anesthesia. With general anesthesia, the patient is asleep and does not feel any pain. A pelviscopy may take around 1 hour or longer. During a pelviscopy, a catheter is inserted through the urethra into the bladder to empty it. The skin of the abdomen is cleansed and sterilized. A small incision is made above or below the navel. A needle is inserted into the incision and a gas is injected into the abdominal cavity. The gas expands the abdominal cavity, making it bigger. This makes it safer for your healthcare provider to see the body organs. A thin, lighted tube, called a scope, is inserted. It is used to examine the organs. If needed, additional smaller incisions are made for instruments that let the healthcare provider treat any problems. When the procedure is over, the scope and instruments are removed. The incisions are closed. Risks and complications. Pelviscopy is safe. However, like any surgical procedure, there are several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. The risks and complications include those related to anesthesia and those related to any type of surgery. Anesthesia is safe, but like any medicine, it can have risks. Complications of general anesthesia may include breathing problems, chipped teeth, cut lips, headache, sore throat, urinary retention. Rarely, anesthesia may cause serious complications. These include lung infections, stroke, heart attack, death. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can happen due to inactivity after surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs. There, they will cause shortness of breath, chest pain, and possibly death. Let your healthcare provider know right away if you experience symptoms of a blood clot. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Antibiotics are usually given to prevent infection. 2. Bleeding in the abdominal cavity. 3. Skin scars that may be painful or unsightly. The following risks are related specifically to this surgery. Again, these are rare, but it is important to know about them. In rare cases, structures in the pelvis and abdomen may be injured during this procedure. This rare complication is more common if the patient has internal scars from previous surgeries. Rarely, the tubes connecting the kidneys to the bladder, as well as the bladder itself, become injured. The intestines and blood vessels could also be affected. If this does happen, another operation may be needed. Rarely, small nerves in the pelvis may be injured. This could cause decreased sensation in the sexual organs. After the procedure. After a pelviscopy, you will be taken to a recovery area for a few hours. You will be monitored closely. You should have somebody drive you home after the procedure. You may experience shoulder pain and soreness around the incision sites for a few days. You may also experience an increased urge to urinate. In women, light vaginal bleeding or spotting is normal for up to 4 weeks after the procedure. Heavy vaginal bleeding is not normal and should be reported to your healthcare provider right away. Do not have sex until bleeding is stopped. Avoid lifting or bending until your incisions heal. Your healthcare provider will tell you how long it will take before your incisions are completely healed and when you can go back to work. You should call your healthcare provider if you develop fever, chills, or vomiting, drainage from the incision or increased redness at the incision site, severe pain that cannot be controlled by medication, inability to urinate or severe leg pain, other unusual symptoms.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A pelviscopy may be used to diagnose or treat certain conditions that affect the pelvic organs. It allows a healthcare provider to see inside the abdomen and pelvis with medical scopes. If your healthcare provider recommends a pelviscopy for you, the decision whether or not to have this procedure is yours. Many medical conditions may require a pelviscopy. A pelviscopy may be used to diagnose the cause of abdominal and pelvic pain, to take a tissue sample of an abnormal mass, or to find and treat an ectopic pregnancy. If an abnormal mass is small, it may be removed during a pelviscopy. Pelviscopy is safe. However, like any surgical procedure, there are several possible risks and complications. Talk to your healthcare provider before the procedure about these risks and complications. After the procedure, call your healthcare provider if you develop fever, chills, or vomiting, drainage from the incision or increased redness at the incision site, severe pain that cannot be controlled by medication, inability to urinate or severe leg pain, other unusual symptoms. Thank you for using Explain.